This provider would prescribe cross-sex hormones at regular visits to healthy minors, to healthy children who were very confused about their sex. And he would affirm the false identities they had adopted. And in my view, he would convince parents that this was the absolute best course of treatment for their confused child.
A second potentially devastating whistleblower has emerged, alleging physicians at Texas Children's Hospital continued to prescribe powerful trans-sex hormones to kids under the age of 18 after the medical system publicly announced it had stopped and after the Texas legislature banned the treatments as a matter of law. Nurse Vanessa Sivage worked within the specialty clinic and is corroborating documents made public by former TCH doctor Ethan Heim, which appear to prove the illegal gender-affirming treatment for kids secretly continued.
And for a doctor to advise parent and child alike that a hormone will solve their inner turmoil or their issue, whatever it may be, is egregious and horrific, and it's child abuse. And so I knew I had to come forward to expose that.
Panel Sivage says her request to transfer out of the clinic because of her religious beliefs was denied, and she was instead fired earlier this month. And has since alleged Texas Children's has billed Medicaid for juvenile gender-affirming care, a claim the health system says it's investigating. A lot to unpack there, Holly. I know you follow this.
Yeah, there's a lot to unpack here. That's a good way to put it, and there is an investigation underway. This is just horrifying, and I'm not going to horrify our watchers this morning with the details of what is actually involved in the so-called gender-affirming care. It is mutilation. It brings a lifetime of pain and suffering to a lot of these people, and these young people under 18, they certainly do not have the wherewithal to be able to make this life-altering decision that is going to render them sterile. It's going to mean a lifetime of treatment, and I just don't understand the motivation of continuing to push this on these children who, in often cases, need a different kind of treatment for mental difficulties.
Sue, any thoughts here?
You know, I haven't really followed this, but I've always said that, you know, this is it's very difficult and for parents and for the child, but that I believe that it's the child should be able to make the decision by allowing them to become adults and then decide what they want to have happen to themselves, not the parents making the decision.
Yeah. Marcus, this is, I can't imagine being a parent in this situation. Thoughts here?
Yeah, I want to make sure we highlight that this is a very sensitive situation for parents to handle. And I can't tell them how to run their household, but I can say my dad had a saying for me. He said, you can do whatever you want to when you're out of my house and you're 18 years old. And I'm not trying to make light of the situation. I know it's hard. A parent wants to do the best that they can, the most that they can for their child. But I know for a fact that as a parent, my 10-year-old is I'm not going to allow my 10-year-old to make a life-altering decision for themselves. I have to be the parent for them. I have to love them through this situation. I have to counsel them through this situation. I've got to get them the best therapeutic help that I can, and then allow them to be an adult and decide for themselves what they do. And shout out to the whistleblower that brought it to light.
Okay, gotta go.